Today is 28th of November, and today from the Forum of Pias we are going to talk on a very important subject, and this problem, which is snake bite and its treatment, is this is a very big problem all over the world, and especially in hot countries. Snake bites are very common, and everyone must know how to manage a snake bite. Firstly, before management of the snake bite, you must understand the, the problem in the snake bites. The problem in the snake bites are, firstly, you must understand the two families of the snakes, which give you a different picture. The two families of the snakes are the cobra families, are the cobras like snakes, and the other family is vipers, khalmaran. Okay, the vipers. So these two give you a different picture, different pathology, different problem. You must understand it. That the cobras are neurotoxic. See the picture. This is a cobra, and in its bite, or when it poisons, it bites a person, it exerts its action and its toxins on the brain or nervous system of the individual, and it makes the person unconscious. It makes the person unconscious and paralyzes the nerves of the body, so the patient becomes unconscious. And the other family, which is a viper family, Khalmaran, they are actually rupturing the RBCs of the patient. They are injuring the RBCs, rupturing the RBCs and destroying the RBCs, and bleeding. Hemolysis starts in the body. The person in the bites of these snakes, the person is conscious, fully alert, but the problem is bleeding from the body. So this is hemolytic group. It causes hemolysis, rupturing of the RBCs, giving you a shock, hypovolemic shock in the individual, and this gives you unconsciousness and neurotoxic shock or neurogenic shock in the individual. So the person is either, if this family bites, he becomes unconscious, he goes into shock, and if this family bites a person, he is alert, conscious, but he goes into hypovolemic shock, bleeds, and there is shortage of blood in the body, and that condition is also called hypovolemic shock. In such situations, what would you do is that bite, they tightly stop the flow of the toxins from the site of bite to the body furthermore, and you tightly bandage or tourniquet the part, by which I mean to say, if a person has been bitten in the hand, so you tie above the bite side, and if a person is bitten in the leg, you apply tourniquet to the side above the site of bite, in such a manner that always mind it that you will tie only the side which is having single bone. If you are tying, say a person is bitten in the hands, so you will not tie here, but you will tie here in the arm, not in the forearm. If a person is bitten in the legs, you will not bind, you will not apply tourniquet in the leg. You will apply the tourniquet in the thigh, because where there are two bones, there are vessels. You are applying the tourniquet to a side which closes the further drainage of the blood in the veins to the upper area, to the nerves and to the vital organs. So in the sides where there are two bones are here, single bone here, two bones are here, single bone here. You will bind single bone area, because there should be no vessels in between the two bones, which are called interosseous vessels. So if you bind the two bone sides, there are interosseous vessels spite of your binding, in spite of your applying the tourniquet, again the blood will flow in between the bones, which is not stoppable in that condition, in that situation. So you will bind a single bone area in order to stop further drainage. And at the same time, you will treat the shock. You will treat the shock by passing a cannula, starting a drip, and also giving the anti-shock treatment. Anti-shock treatment is injection antihistaminic by the name of Evel, and also at the same time Decadron or Salocort, which are steroids, and similarly give fluids in the form of normal saline in the ringer, and think of blood. At the same time also manage urgently blood, particularly in the bites of these families. Arrange blood and also pass catheter in order to note the output of the patient. And these conditions, in such situations, what we are worried about, the functions of vital organs. What are the vital organs? Brain, heart, lung, and kidneys. So we are worried about the brain, the supply to the brain in the terms of oxygen and glucose. We must make sure that the brain restart its functioning in a proper manner, give glucose, give oxygen by whatever means is available. If oxygen cylinder is available, apply oxygen properly. Even you can intubate the patient. And if the oxygen cylinder is not available, at that time you have come across this problem in periphery, start mouth-to-mouth breathing. Start mouth-to-mouth breathing in order to give oxygen to the vital organs. The brain, heart and lungs also resuscitate. Give the resuscitation measures to the heart, and at the same time you raise the ligaments, the foot ends of the person by whatever means is available in order to shift the blood from the non-vital areas to the vital organs. Pass a catheter to see whether the kidneys are functioning or not. Give plenty of fluids, arrange blood, treat shock, and send the patient so quickly as possible to the nearest hospital. So the secrets are save time, send the patients, and these are the measures you can do. At the same time, apply the regional block, regional anesthesia to the site of bite. You will apply the local anesthesia above the bite site, and you will also, this way you will reduce the feelings of pain sensations, and also you will wash and you will scrub, you will ensure bleeding from the site of bite. So you will tourniquet the leg, the extremity in the single bone area. You will apply local anesthetics above the site, and you will ensure free bleeding. You will wash the wound with soap and with also antiseptics, and you will give a cut in order to bleed, in order to encourage bleeding from the side, so that whatever the residual or leftover toxins are there, they must come out, they must be bled from the body, out of the body. And you will shift the patient to the nearest hospital so quickly as possible. Keep the patient under observation, don't discharge if he is even alright, but keep the patient at least for 24 hours with you under your supervision, so that when you are dead sure that the vital organs are working properly and the person has no problem at all, in whatever the systems he is having, only then. And also arrange the anti-snake venom, which are the antidotes for the venom of the snakes. The antidotes, venom against the snake venom are called ARS ASV anti-snake venom, which are available in the DHO's office and which are also available in the market. So you will give anti-snake venom, you will treat the shock, you will support the vital organs, and you will give the regional blood to the site, you will tourniquet and you will wash the wound and you will look after the wound afterwards. Similarly, you will not discharge the patient till 24 hours and keep an eye on all the parameters, on all the vitals of the patient. These patients should preferably be treated in ICUs, intensive care units, because any problem, anything can happen. This is highly unpredictable situation and unpredictable emergency, medical emergency. So this, if you have any question, you have any questions?